Hi guys, I'm Dr. Sandeep, your surgery guy. Off late, I've been receiving a lot of messages from you regarding the GT saying that, my score is not good, I'm not able to score well, I'm making silly mistakes, I'm not able to recall from the topic I have read, I am anxious, am I still on the race, can I make it, can I get my seat, can I get my dream branch? All these questions. Guys, relax, calm down, it's just a GT, right? Don't worry about it. A very important thing that I would like to tell you is if you're making silly mistakes, that means you have not revised it well. If you're not able to recall from the topic you have read, again, you have not revised it well. If you're not able to answer the question about a topic that you have read, that means you did not understand its concept, right? And if you have done everything right and you're still not able to answer, then you have a lot of anxiety. Calm those nerves down. You don't need those anxieties. Everything else, just push it away. All the negative energies that you're getting around, just make sure that you keep your head down and focus on the task. Guys, you got only less than 2 weeks around the corner. Don't give it up right now. Remember, the most difficult step is the next step. And who might know, the next step is the ultimate step, right? You cannot afford to stop down. You cannot afford to stop now. You cannot afford to listen to the other people. Let not GT hamper your morale or the confidence. Now, you need to understand GTs are designed in a way to be a little bit higher than the standard exam standards so that you are well prepared. Now, take GT as an opportunity, right? Don't treat it as demon. If you have got anything wrong in GT, you know where your mistakes are, you know what your weak points are, revise them, make it strong. Nothing more than that. What you know, you already know. What you don't know is what we are trying to tell you through GT. Keep that in mind, focus and keep moving forward. The golden rule that you have to follow right now is revise and only revise, nothing else, right? Another way that I would like to help you down here, if you break down your entire exam, right, the whole exam that you look at in terms of your central exams or NEET per se, you need to understand that 70% of your NEET topics are usually repeat topics. And guess what? The toppers who are in the first 100 ranks usually score only 70%, right? So you are not aiming for 100, right? If you're able to revise, retain those 70% of your topics, you will be able to get into those top rankers. It's not late. It's not that you're not in the race. It's not that you have not done well. You are there. It's not late. It's never late. You need to start putting in effort. That 70% is all that it matters, right? Get that 70% and you will be in the top 100. All that I'm trying to tell you is, let's focus these 2 weeks. I would like to ask you a very, very simple question that if I tell you that in these 2 weeks, if I can get 7 hours of yours, I'm not asking for much, only 7 hours, 1 hour per subject in a clinical scenario, I would make sure that you get that 70%. That is why we are coming up with a series called as Sure Shot series, right? In a Sure Shot, I will be taking up surgery as 1 hour and I will be giving you those 25 to 30 topics in which usually you get 25 to 30 questions in exam, right? Same way we'll be doing it for medicine, pediatrics, we'll be doing it for pathology, we'll be doing it for obs and gynae. We will have 7 subjects which will make sure that it covers almost all 19. We'll give you in a nutshell and we'll try to get you that 70% mark. Let's do it together. Remember, very, very important thing. I'll give you a very scenariotical answer to understand what's going on. If you take this bottle, right, it is filled with water. This is the entire medicine, right? And this is what you are supposed to know. Unfortunately, our brain is only this much, right? For this much brain to fit into this much amount of energy or this much amount of knowledge and volume is practically not possible. You need to put it selectively. Now, the thing is, I can start pouring from the bottle, but I'm not sure how much will go into the bottle and how much will fill out. It's not gonna determine that. The problem is, in order to get this into this in a rapid fashion, you need a source, right? So this is the medicine, this is your brain, you need something to link up, and that source is this, right? Now, there might be many sources that are available, right? I'm not criticizing anyone, I'm not saying one is best, the other one is not, but remember, choose this wisely, because a lot of people who will give you as a source and they will give you a source which is like this. It is tight-lipped, bottled, and then we say we'll start pouring in, right? Nothing is going. Obviously, it will also spill out because there is an obstruction. Then let's say a few of them say that you can take out this obstruction and throw it out, right? They'll say, we'll give you the source, but the problem is they put it this way. If you start pouring, what difference? In fact, it make it more narrower, right? So choose your source carefully, because if the source is proper, right, the knowledge that is required will go straight up. This is your brain. This is us, right? We as your source, and this is where you start pouring. And as you continue to pour, not even an ounce is wasted, no wastage of time, and everything is retained back in, right? All that it matters is choose your source wisely, right? So give us your 7 days, 1 hour per day, and let's make it happen, right? I'm in it for you. I will be doing it for you. I'll be cheering it down for you. Let's get to the end of the road and make this NEET happen, right? Thank you, guys.